Okay, so hey again guys, I'm sorry my second video or my first video got interrupted, and then so I'm restarting this video. I'm just going to pick up where I left off because I feel like we can just continue on with what we were discussing, and what we were discussing was pregnancy. So moving forward from abortion into pregnancy, and there's a lot of different things that come with pregnancy, and it's exciting and it's scary all at the same time. So when you're talking about getting pregnant, you need to think about someone else, someone other than yourself at that point. So you're growing another person. So when you're thinking about pregnancy, or you're trying to get pregnant, you need to think about your risk assessment. So do you have a genetic component that could create Down syndrome, or are you at an older age which causes more genetic risks? Are you a smoker? Are you an alcoholic? Are you addicted to something? All of those things play into factor when you're thinking about pregnancy. You also have to think about health promotion. So you have to promote your health, because at the end of the day, you're growing another person, so your health means the world to that person that you're growing. That's the only nutrients that that person gets inside of you, so you have to be aware of your own health, and you have to promote health. Interventions to reduce risk, so making sure that, again, you are aware of your risks and what you can do to intervene whenever those risks come into play. So then we're also talking about the next steps. So this goes into phases, right? Thinking about getting pregnant, knowing your risks before you're pregnant, and then trying to get pregnant. So that's the sexual health part of it that we talked about on Tuesday. Obviously, sex leads to pregnancy. So in talking about that, then the next step is pregnancy test. And there's lots of different pregnancy tests out there. Home pregnancy test is typically what most people use until they go to the doctor or find out that they're pregnant. Just recently, my best friend found out that she's pregnant, so her and her husband are expecting a baby, which is exciting for her. But she used a home pregnancy test, and it actually told her she wasn't pregnant. So she tried the home pregnancy test about a month ago, and it said she wasn't pregnant. So home pregnancy tests detect the hormone and chemical HCG in women, which is secreted when the fertilized egg implants into the uterus. So sometimes home pregnancy tests can give you a false positive or a positive negative because of HCG levels, sorry. So home pregnancies are about 85 to 95% accurate, and that again is due to hormone levels. So going back to my friend, she hadn't had her period. Still hadn't had her period. She took another pregnancy test a week later. She still had a negative. So she kind of left it alone for a little while, thinking, okay, well, maybe my levels are low. We had talked about it, her and I, and that's what we came to understand was maybe it was HCG levels. And she took a pregnancy test about 2 weeks ago now, and it was positive. So she did have low HCG levels, which caused the test to be negative. But eventually, once the egg has been fertilized and is placed in the uterus and it's starting to grow, then it's going to give you that positive that you're looking for to tell you that you are pregnant. If you don't get your period, then that's a pretty good sign that there's something there. There's something that you do need to acknowledge and then go to the doctor, because more than likely that blood test, not more than likely, that blood test will tell you if you are pregnant or you are not pregnant. Whether the home pregnancy test tells you yes or no. So if you want to know for sure, the best way for you to do that is to go to a physician and get a blood test, and they will tell you yes or no 100%. Blood test is never going to lie to you. So moving forward with pregnancy, so if you are pregnant and you did take a pregnancy test, the next step obviously is prenatal care. So you are now pregnant, you are growing another human being. Prenatal care is very important. You need a healthy diet, and a healthy diet consists of a lot of folic acid. If you go to any gynecologist, a good gynecologist, they're gonna tell you to amp up on your folic acid if you're trying. Or if you're not trying, folic acid is really helpful for pregnancy, really helpful for babies. It's very important that you have folic acid in your diet. If you take folic acid vitamins, then that's the perfect way to help with your pregnancy. Another part is, and they'll tell you this a lot of times if you talk to pregnant people, you cannot eat unpasteurized cheese. So everything has to be pasteurized, and a lot of times they're going to tell you to stay away from deli meat. So it has to be heated up. It can't just be cold due to a lot of different chemicals in those things. You also need to make sure you have a wide variety of fruits and vegetables. You really need to get that nutrition in there. You have to get a wide variety of color, so not just your plain bananas or red potatoes, whatever it is, you have to make sure that you're providing lots of nutrients for that baby. And the only way for you to provide nutrients is for you to eat it yourself and for that baby to get it through your bloodstream. So apples, bananas, strawberries, blackberries, blueberries, vegetables, the non-starchy vegetables, so carrots, celery, black beans, I'm trying to think of some other ones, zucchini, squash, if you like eggplant, spinach, all of those things, you need a wide variety. So again, get that color palette going and make sure that you are doing that anyways without even being pregnant. It's a good thing to have in your diet. You also need to, while you're pregnant, increase your calorie intake. You are feeding two people. You're feeding yourself and another person, so you need to up your calorie intake, not by a lot, but by enough to supply nutrients to that other person that you're growing. And your book also heavily discusses not to avoid any specific foods unless they are they cause an allergy. So you don't have to avoid one specific food because of a fad or because you think that it's bad necessarily. More than likely it's really not going to hurt anything. So unless your doctor says otherwise, don't ignore or avoid food just because of a stigma or because of some sort of article that you've read. If you did read an article and you find it to be alarming, I would always call your doctor or your midwife or your assistant physician while you're pregnant. That's the number one person that's going to supply you with information, and they're always on call. When my best friend got pregnant the last time, she was always calling her assistant or her physician's assistant, asking questions, making sure that she's doing the right thing. If a fever broke or she had a fever, she was sick, she always called them first and not the other doctor at urgent care. So it never hurts to ask, and it never hurts to reach out. That's what those people are there for. That's why they have their degrees. They make money off of you. So use them. Another way for prenatal care, exercise. Exercise. Don't be a bum, because eventually you're going to have to give birth. And when you give birth, it's a lot easier for you to do that when you've been exercising versus doing nothing. So continue your exercise routine. If you strenuously exercise before you're pregnant, keep doing it. Keep doing whatever your exercise routine is. Don't be afraid of that routine. Don't think that just because you're jumping up and down, you're going to jar the baby. Keep doing whatever exercise it is that you're doing until your doctor says otherwise, obviously. The one thing that the book did suggest is that if you didn't exercise strenuously before you were pregnant, don't do it while you're pregnant. So anything you didn't do before your pregnancy in relation to exercise, don't do it while you're pregnant. There's no need for you to push your body even further while you're growing another person. Your book also makes fine points to say that you should not participate in exercise that involves contact. So contact sports, anything that could allow you to fall, anything that could allow you to put pressure on the baby. So water skiing, skiing in general, football, basketball is a little iffy sometimes too. All of those things that are contact sports like boxing, especially, that again could put pressure, like someone punching your stomach, you falling on your stomach, you falling in general. All of those things could lead to miscarriages, could lead to problems with the baby, amniotic sac busting, fluid problems. All of those things could accumulate if you fall or you get hit with some sort of ball. So make sure that you're keeping that in mind and you feel comfortable with what you're doing and you've talked to your physician about it. Obviously, you need to avoid smoking and you need to avoid smoke in general. So if you are pregnant or you're trying to get pregnant, a lot of those things can cause detriment to the baby and you as well. So you want to make sure that you're avoiding all kinds of smoke, regardless of what it is, whether it's cigarette, vape, marijuana, any kind of smoke that could cause detriment to your child or yourself, you need to avoid. You need to be at 110%, because honestly, let's really think about it. All of your organs have to be 100%. If they're not 100%, you're going to struggle to, one, develop a child fully, to develop a child well, and for them to be healthy and safe, and for you to be healthy and safe, because you're basically you're creating another person inside of you and pushing another person out of you, and that's a big responsibility, and that's something that you need to consider of what's healthy, what's not healthy, the pros, cons to it. And obviously you need to avoid alcohol and drugs. Any kind of prescription you're on, you need to make sure that it's okay and clear it with your doctor, because you don't want to be taking prescription drugs when they're not good for your baby, because again, it's bloodstream. So anything that you put in your body, your baby's going to get part of, because it's attached to you. Literally, it's attached to you in every single way possible. So keep that in mind while you are pregnant and all this prenatal care. So avoid drinking. That one drink is not worth the risk of your child. You don't need to drink that bad. And if you do need to drink, then you might have a problem, okay? So avoid all of that. Now, moving from prenatal care into how a woman's body changes during pregnancy. And it's, again, all of this subject is amazing to me. And it's amazing what the human body can do and what it controls. So pregnancy and how the human body or the woman's body changes. Pregnancy is divided up in between 48 weeks. So pregnancy is 40 weeks, not 48. I'm sorry, that would be a very long pregnancy. 40 weeks divided into 3 months per trimester. There's obviously 3 trimesters. So the first trimester, the woman's uterus becomes slightly larger, cervix becomes softer, more bluish for more blood flow. So cervix is going to change, uterus is going to change. Then the progesterone and the estrogen trigger changes in the milk glands in the breasts and ducts in the breasts, and that increases size to accommodate for the lactate that's going to come after you have your baby, and they're going to be more tender. So when you're pregnant, your breasts are going to enlarge, and they're also going to be a lot more tender because they're growing. The milk does not come in until after your pregnancy and after you've had your baby, so milk comes in, I think, between 5 and 7 days, and then you're lactating a lot. So you typically lactate, and it tends to be painful. I've heard lots of stories about painful lactation. Then further, so there's pressure that's coming from your growing uterus, and that pressure pushes against your bladder, which causes you to pee more. So that's why when women are farther along in their pregnancy, or they've already had one kid, it puts a lot more pressure on their bladder, which causes them to have to pee more. So you do hear about pregnant women peeing a lot. And then again, as it progresses, women's skin stretches. So that comes into play with stretch marks. And also the center of gravity changes. If you think about it, that woman is carrying another person again. So her gravity is going to be, her center of gravity is going to be off because she has a protruding abdomen. And then all of her internal organs also shift as the baby's growing to make room for that baby. So there's a lot of stuff going on. It can be kind of painful to shift around because it's uncomfortable. You're not used to that. There's a lot of stuff going on. Your body's trying to accommodate the growth. Your body's trying to accommodate the stretching. So it's amazing to me to hear about all of these changes that go on in the woman's body during pregnancy. Now, during pregnancy, we've talked about pregnancy now, the body changes in pregnancy. Now we're going to talk about childbirth. Actually, no, sidetrack. We're going to talk about baby growing, and then we're going to talk about childbirth. So, how a baby grows, and I have provided a video on your PowerPoint, and it's absolutely fascinating. So please watch that video. It is very in-depth, and it is very informative. And it's going to help you understand how babies develop, and it's going to give you a new appreciation for children. So, the zygote reaches the uterus. That's the first step. It implants into the uterus, and it implants into the uterine lining. Then from there, it forms into an embryo. And the embryo takes on an elongated shape. And that elongated shape is called an amnion. Okay, oh, it sounds like an amniotic sac, right? That's why. Then, once it's formed its amnion, then the water and other molecules cross that amniotic membrane, and the embryo floats freely in the absorbed fluid, cushioned from shocks and blows. So that embryo is now no longer attached to the uterine lining, it is floating in the uterus. And it's inside this nice little cushion to absorb blows. At 9 weeks, the embryo becomes a fetus. So again, it's growing and it's becoming bigger. Then from there, a special organ called the placenta forms. From there, it attaches to the embryo. Well, actually, it forms around the embryo. And it attaches as an umbilical cord, which supplies fluid and nutrients to the growing baby, as well as carrying waste from the baby out to the mother's body to be disposed of. So not only does the umbilical cord bring fluid in, it pushes it out, which is fascinating because typically we have multiple arteries, veins, etc. that do that for us. But it's just one. It's just one cord that does that for a baby. So bringing it in and pushing it out. And that's what the umbilical cord does. So again, fascinating stuff for you to watch that video on how babies grow. And then let's talk about childbirth. So childbirth, there are 3 stages of childbirth. And the first stage is used in terms of effacement and dilation. So effacement is the turning of the baby and how it's centered inside the womb. And then dilation is how much the cervix is opening up. So those are the inches that the cervix is opening up for the child to come through. The stages give you a rough estimate of how long they last. Now the first stage is labor, basically. The first stage is labor, and that lasts, it can really last however long. The average is 12 to 13 hours for you to get fully dilated and for you to have a fully effaced baby. Now, the first stage is the first contractions, which typically are 15 to 30 seconds every 15 to 30 minutes. Obviously, as labor increases and strengthens, those are going to become closer together. The closer together your contractions are, typically the wider your cervix gets and the more your uterus wants to contract and push that baby into your vaginal canal. So it's a good thing when your contractions increase because that means labor is speeding up. Now it's not such a good thing because it's very painful. So the most difficult contractions come from 8 centimeters and on. I'm sorry, I said inches earlier. I meant centimeters. So 8 centimeters dilated is where all the heavy contractions and all the heavy labor comes. That could take you a while to get to 8 centimeters, and it could take you even longer to get from 8 to 10 centimeters. It just depends. Typically, your first child is going to take the longest, and after that, it doesn't take as long. Everyone's different. There are different things going on in the body, and there are drugs to speed up labor, but that's typically not recommended, and they try to wait it out before they give you those drugs. They also have what's called a spinal tap. It's not really a spinal tap. They put a needle in your back for pain during childbirth, and typically they will give you some sort of drugs to relax your bottom half so you don't feel the contractions anymore. You do feel the contractions, but they don't hurt as bad. You feel that they're there just enough for you to be able to push, but they aren't significant. They're just acknowledgeable. So that helps with the pain of childbirth. Now, moving to stage 2, which is where the cervix is completely dilated. This is where the baby is moving into the vagina and through the birth canal and out of the mother's body. This typically takes anywhere between 60 to 90 minutes. That's the average. So this is the baby coming out. You're pushing the baby out. Your uterus is contracting, and it's pushed the baby into the vagina and through the birth canal. The baby's head appears, and that's called a crowning. And the doctor is helping the baby. They're trying to get the baby out. The ideal scenario for childbirth, natural childbirth, is for the baby's head to emerge, and then for the shoulders and the body. You don't want to do it the other way around. The reason you don't want to do it the other way around is because limbs get hung. You can do permanent damage by doing it the other way, and you want your baby to be effaced. Most of the time, if babies are not effaced and they're not dropping properly, the doctor has to stick their hand all the way up there and turn the baby around, which is extremely painful. And doctors try not to do that. The other option is the C-section, and that's where they cut you open from your uterus and they pull the baby out. That is a much longer recovery time versus natural childbirth. Another mishap during stage 2 is where the doctor may have to perform an episiotomy. And an episiotomy, I'm pretty sure episiotomy, yeah, there we go, I'm saying it wrong, I'm sorry. Episiotomy, and that is when the doctor has to help. So they have to make an incision. So they're cutting the vagina down to help the baby get out. So the canal or the vagina is not large enough, so they are having to make an incision to get the baby out. Stage 3, that's where the uterus contracts firmly after the birth of the baby. And this is typically when the woman expels the placenta. And if that incision was cut and made, the doctor sews up the incision, so you have to wait for the stitches to heal. And then the C-section, you also have to do a lot of help with that. That takes a lot of time for recovery. Okay, and then moving forward to complications, because there are complications. That's life, and there are things that happen, unfortunately. So things with pregnancy that could go wrong, and hopefully they don't, but they could. There is an ectopic pregnancy. That's where the egg grows in the fallopian tubes. So the egg never drops to the uterus. It stays in the fallopian tubes and grows, which is extremely painful. A miscarriage, that typically means that the body terminates the pregnancy before week 20. So the body dispels the baby before week 20. Infections, so there can be a lot of different infections, and that can lead to birth defects or miscarriages. The baby thinks that there's something that it needs to get rid of, so it dispels it. The uterus gets rid of it. Genetic disorders, the mother's age is associated with a higher risk of the genetic disorders. So the higher, the older the woman is when she's pregnant, the more at risk the baby is for Down syndrome and lots of other genetic disorders. And then premature labor, 8% of babies are born too soon, and most of the time, premature babies, they have to be at a certain age to survive. So after a certain point, babies can survive, but they can have a lot of risks due to that happening. I personally have not been pregnant before, and I'm not at the age to have kids yet. But like I've been telling you guys, my best friend is pregnant. She was pregnant last year at around the same time, and unfortunately she had a premature labor, and the baby was 26 weeks, and he was not old enough to sustain, so he was 1 week out from having fully developed lungs and potentially being able to grow and survive, but unfortunately God had other plans. So around January, she had a premature labor and he was stuck in her birth canal, and the uterus was trying to fight an infection, wasn't sure what was going on. Her cervix opened prematurely and he got stuck in her birth canal, and there was nothing that they could do. So that's my personal story with premature labor and complications of pregnancy, and unfortunately they do happen no matter how healthy you are, no matter what you're doing, because like I said, my best friend was extremely healthy. She was exercising. She wouldn't even drink coffee. So she blamed it on herself, but that's just how it goes sometimes. Of the body is trying to dispel something that it thinks is foreign and it thinks that that's wrong. So that can be a cause of premature labor as well. All right, and then we have the next phase of what we talk about with pregnancy is infertility. A lot of people struggle with infertility, and the different options for infertility. You have artificial insemination, assisted reproductive technology, and adoption is also another option. So artificial insemination typically means that they inject semen into the woman, and it is inseminated that way. Or they do it outside of the body. They inject your egg with the sperm. They wait for it to take or not take, and then they put that egg into the body. The assisted reproductive technology, that's a little different, and then adoption, obviously. You also have surrogacy, where someone else carries your child for you. That's a fertility treatment. So, well, it's not really a fertility treatment, but it's also an answer for fertility. A lot of couples do surrogacy. That's an option for you. So that is a majority of the information that I have for you, and I know that's quite a bit for you to swallow. This week for participation, I would really like for you guys to do a discussion board. So I have a discussion board set up for you guys, and I want you to each answer a selected question that I'm going to give you. I'll give you multiple questions that you can choose from. You can answer one question. I want you to be in depth, and I want you to be thorough. I want it to be at least more than 8 sentences. Excuse me. And I want you to really think about the questions that I'm asking you. And then I want you to reply to 2 of your classmates' discussion board post. So I really want it to be like a class discussion, and because there's so few of you, it shouldn't be too difficult. I would really like for this to be done by the end of the day on Thursday. So Thursday, by midnight, I want this completed. So I have questions provided for you. It should be in your course content under week 9, I think. Week 9 or week 10, whichever PowerPoint or section this PowerPoint is under. And make sure that you are, again, addressing those questions, and your responses to your classmates need to be actually responses, not just great job, I agree, good thought. I want them to be more thoughtful. I want it to be a discussion. I want you to go in depth about this, and I want you to think about all of these things because it's real life. This is real life stuff, and at some point, maybe not right now, well, I mean, sexual health right now, but the reproductive choices do have a role in your life, and maybe not pregnancy, but at some point in your life, you're probably going to have a family or want to start a family. So all of these things are important to discuss, and I really want you to carefully think about them and discuss them with each other and discuss your thoughts on all of this. So that's what we're going to do this week. You'll have your discussion board. That'll be your participation points for Thursday's class. And then Tuesday we will, I don't think we have anything on Tuesday. I think Tuesday is an advising day for me. So I don't think we will have a hybrid class that day. Thursday we will have class. So we will have in class next Thursday, a week from Thursday, so a week from today, we will have in class. And I will see you then. I will get back to you on Tuesday if we will do hybrid, but if my memory serves me correctly, we do not have any information to cover that day. So plan on not having a hybrid that day. Do not forget about your discussion, and I look forward to reading your posts. Have a good weekend, guys.